To think about sharing a slide like this a year from now and showing even more people and in more places across the country, helping to address PrEP and its impact from research to advocacy to access, and most importantly, to preventing new HIV diagnosis. So I'm gonna pause at this time and turn it over to I think Danielle or John to talk about some of PIBA's milestones.
Hi, everyone. I'm John Mead, one of the PIBA steering committee members. I'm also senior program manager for policy at AVAC. And we have, since PIBA's inception, we have done a lot of work in this field, specifically geared towards PrEP access in the Black community. I see a lot of familiar faces. I see a lot of new faces. So welcome if you're new, and welcome back if you are a returning PIBA-er. I don't know what noun to use. But next slide. Can I do it myself? Oh, there we go. So one of the main things that we do here at PIBA is we educate the Black community on the science and the effectiveness of PrEP, right? As we know, the educational gap between Black communities and other racial ethnic communities is vast. When it comes to new technologies, we just heard about last year, lenacapavir has been booming onto the scene, right? A couple years before that, it was cabotegravir. And one thing that was resounding was that our community doesn't know about it until it's at the last minute, if at all, right? So what do? We go into the community. We do a lot of webinars, right? We did one last year to talk about Len. We brought in Gilead scientists to come talk to over 100 community members, leaders in Black HIV, the Black HIV movement, to really talk about the science. What do all of these technical, if you're not a PhD, like bring it down to my level, because I do not have a PhD. Bring it down so that I can understand what this data means, right? So we had that conversation and it was very well attended. And there were a lot of great questions that were asked and answered on that webinar. Also, we highlighted an amazing research study, HPTN 096, Building Equity Through Advocacy, right? It's an integrated status neutral approach for ending the epidemic among Black gay men in the South, right? We're highlighting research that has been done in our communities around PrEP access. What are the challenges? What are the barriers? What are things that are innovative that are working in our communities? We ensure to highlight that so that the whole community will know about it. We put out publications, right, talking about this new injectable lenacapavir or cabotegravir, right? It's a new promise. It's promising to be groundbreaking, but promise for who? Right? So we put out publications. Also, in Think Global Health, I authored with other colleagues in Seattle, Ending HIV, Balancing Innovation and Affordability of Lenacapavir, right? We say it's groundbreaking, we say it's innovative, but is it affordable to really systematically get it out there to the communities that need it the most, especially the Black community? We present at all the major conferences, right? USCHA, Biomedical Summit. We do pre-conferences. We did a pre-conference a couple years ago at the Biomedical Summit when it was in Seattle. We go to SOS conference in Atlanta with SAC. We go to all the major conferences to talk about HIV PrEP access in the Black community. So this is one of the main ways that we work to ensure that our community is educated first and foremost on what is happening so that they can go talk to their local health department, talk to their providers, talk to their friends, talk to their girlfriends, their boyfriends, their partners, whoever they need to talk to about PrEP, because most likely those people haven't heard about it, right? Next slide. We also, and before I get to the advocacy level, we also put on lots of convenings. We are a convener, right? We convene together researchers, advocates, community members, PrEP navigators, PrEP users, college students, graduate students, professors, and we bring them into one space. Our first one was in Atlanta at Thrive SS, a Black-owned, Black-run community-based organization in Atlanta. The next stop was New Orleans, where we went in May of 2022, 23, I think. Then we did our pre-conference, as I mentioned, at the Biomedical Summit in 24. And we've done obviously virtual webinars, town halls with folks in Memphis, West Memphis, Tennessee, and I'm forgetting Arkansas. There we go.
And
Together,
Alabama.
right? Alabama, thank you. And we also do, and in those convenings, we invite federal stakeholders so that they could hear from you all, the community itself, about what they need. We interacted with ONAP when Harold Phillips was there before he went to NMAC. We've interacted with NIH on multiple occasions, with CDC on multiple occasions, and with all the major agencies, HRSA, etc. When it comes to HIV in the Black community, we ensure that the federal stakeholders are there too, and we have a connection with. Those connections might look a little different now in 2026, but we still have a foothold in those avenues as well. Oh, advocacy. One of the main things that we do is advocacy. The first picture you see is a couple years ago when USCHA was in Washington, D.C. We did a rally where PrEP in Black America was a highlighted speaker talking about how this was the first round of cuts that we were fighting for in a couple years ago when it was, I hate to say this, but only $300 million, right? Now we're talking billions and like billions of dollars that they're trying to cut, right? But then obviously it's any amount of money cut is an issue and it's a problem. So we were on the we could see the Capitol from where we were rallying. The middle picture is with Dr. Robin Neblet Fanfare at the CDC at our New Orleans convening. They always have supported us in everything that we have done. The right top picture is us getting an award from Congressman from Louisiana about for the work that PIBA has done to educate, as I mentioned, and advocate for the needs of the Black community. And the bottom picture is myself, Michael, and Harold Phillips when he was then the director of the Office of National AIDS Policy. Um, Move on. Our key recommendations are to energize, educate, and support, right? Energize the Black public health workforce to lead the HIV prevention response, educate the Black masses on the science and effectiveness of PrEP, and support a federally funded national PrEP program with obviously our community in mind. Next slide. One major thing that we did last year was we launched the Advancing the Movement HIV Research for Black Communities, right? We were doing all of these convenings and they were policy focused and programmatic focused, which is obviously necessary, right? But we need to start at the beginning. Before we had a Truvada and a Descovy and a lenacapavir and a cabotegravir, there was research done, right? And Black communities are disproportionately not engaged in the research process when it comes to finding these new innovations. So if they're not involved in the research, what makes you think they're going to take advantage of it when the product is approved and meant to be is effective, it's approved, it's on the shelves, it's ready to go in your body? What makes you think we're going to be a part of it? Right? So this is a initiative spearheaded by our PhD, Danielle Campbell, to really advance the movement and when it comes to HIV prevention research. And we have this like power kind of mantra or like overarching kind of like goal recommendations. P, we need to look into the pipeline and mentorship when it comes to the Black research enterprise, right? Ensuring that young Black researchers are being mentored and making sure that there's support for the existing Black researchers that are in our field, which are a lot. The O is ongoing direct funding, right? As we know, last year, NIH was basically decimated, right? When it comes to certain grants, research grants, if it had something to do with diversity, equity, inclusion, HIV it was attacked, trans and gender nonconforming communities was attacked. All of these very specific, very targeted attacks, right? So we need to ensure that there's ongoing direct funding to these institutions and these PIs that are Black. Widespread education on PrEP and HIV science. We've talked about we need to educate, educate, educate. E, empower the Black public health workforce, and R, reform policy around a national PrEP program. All of this is in our new research agenda. I'm sure someone will put it in the chat so that you all have a copy. We could direct you to our website where it's on our website so that you can delve deeper into that so that you can really um, just eat it all up. Next slide, please.
So, John, the next slide actually goes
Oh,
into our committees. I do
perfect.
want to say, though, for those who have joined us, one, thank you so much for joining our coffee chat on today. And as we continue to talk about PIBA and its structure, I really want to center this power model. And as you read through, we will ensure that the website is in the chat as it is also on one of our slides. But as you read through this particular power model, this is our blueprint for our work in 2026. So if you see something, if one of these components of this model stands out to you as I want to be involved or engaged in that, we are asking you to consider joining PIBA to help us successfully implement these components. Okay, so I'm going to stop sharing my screen at this time so that you will have the opportunity to see the lovely faces of PIBA steering committee members who will be sharing about their particular um, committee that they are leading. And first, we're going to start with research and evaluation.
Thank you, Leisha. As you see on our screen, Justin, John, and I are the co-leads for the Research and Evaluation Committee. So just a little bit about what we do within the PIBA structure. Our job is to support evidence-informed decision-making by translating existing work into clear action steps. So there's an implementation science piece to the work that we're doing, but also assessing the impact of the programs and events that we've done. So, for example, John talked about the summits that we have held. How do we know how much of the needle we are able to move in terms of our efforts? So, the members of the Research and Evaluation Subcommittee help to review evaluation data, um, track emerging research and literature so that we are up to date on the latest findings, and also distinguish between research and evaluation in order to inform our strategies and action steps. And so we also support community accountability by making sure that we are sharing our findings back with the communities that we care about and that we are a part of, um, and engaging in those broader conversations and really normalizing research and making sure that research is accessible, particularly on this point. So that is an overview of what the Research and Evaluation Committee does. And I invite John and Justin to offer anything else.
No, I think you said it perfectly, Stacey. I don't have anything to add.
Same.
All right. Next up is our Policy and Advocacy Committee.
I can start. So as you know, the last year and 14 days has been a lot in the policy realm when it comes to HIV, right? So this committee is going to be its job is to track and shape HIV related policies that are impacting Black communities. We're monitoring legislation, looking at the budgets. Right now, we're in a budget crunch because if the Senate and the House doesn't get it together, we're going to be in another shutdown by January 31st, right? So we are watching that. We're ensuring that process and what goes into those bills are things that are favorable to our community, right? As you may have heard in the last couple weeks, Florida ADAP, right, is changing the rules, right, around who can be on that program. Just yesterday, SAMHSA, the Substance Abuse Mental Health Agency, right, that puts out grants for homelessness, addiction, substance use, all of that stuff have been canceling grants left and right to the tune of $2 billion. Right? So these are the things that are going to affect our community, and this is the committee that is going to be put into action, right? Rapid response, right? It's going to be about responding, responding, responding. I'm sure a lot of us have contacts in the House, in the Senate, whether you talk with them often or not. In this committee, you're going to be talking to your congressional leaders a lot more, right? On behalf of your communities, right? So that is what this committee is about trying to be proactive. But as we know, the last year, we have been very reactive because we really don't know what this administration is doing. Every day it's a new thing that we can't, well, how could it get worse? And then the next day it gets worse, right? So, if you want to join this committee and be a part of helping to develop advocacy strategies, talking points, join congressional meetings, this is the committee to join if you want to actually tangibly do something to stop all the craziness that's happening. Yeah, and I'll pitch it to Mandisa and Justin if they want to add anything.
Nope, you did a great job.
One thing I'll say, and thank you, John, just for all that you talked about, which I really thought was like a good way of talking about the policy team, because like so much of our accomplishments have been in the policy and advocacy realm. Um, Something else that's important in this moment in particular is the a necessity of innovation. And so please don't think, well, I'm not a policy wonk. I've only been doing this for a certain period of time, so I can't possibly be a part, of the policy team. And that's not true. And also, innovation is something that is going to see us through in this moment. So even if it's something that maybe hasn't been done, being able to talk about it and bring the questions and think through other strategies, especially with what's possible at the state and local level, is also what we're looking for as well. So I think it's better just to ask the question than to think, oh, I couldn't possibly be a part, because we need to do that. Also, last year, PIBA, in connection with several Black-led, both national and regional organizations, including my organization, Center for HIV Law and Policy, filed a historic amicus brief in the what was the Braidwood versus Becerra case. And it was the only brief out of tens of briefs that explicitly talked about the potential harm to Black people, especially Black people in the South. So I can share that as well, a link. But the reason why that brief is so powerful is because PIBA and the other people who were a part of it, like CHOP, like Black Out in Kansas City, like One with the Vision in New Orleans, is not afraid to center Blackness and to say Blackness, even in a climate in which we're being told words like Black and trans and queer, you're not supposed to say. We said those Supreme Court clerks are going to have to read Black and understand the impact on our communities even if the outcome isn't favorable, which it turns out it was more or less favorable for our communities. So there's also opportunities in this moment to do more things like that. So, yeah, I'm excited about this committee, but I'm also excited about the others. So.
Mendice, I don't know if you were feeling the love, like everybody ready to get their Black Power shirts on and ready to go. You gonna have to say our name and who we are. And Stacy already got his shirt on, just in case you mentioned it. He was he was ready. Uh, Michael is gonna come and talk to us about our outreach community engagement committee.
Hello, one second. I went to let the dog out and misplaced my notes.
No worries.
No, so yes, so the outreach committee focuses on expanding awareness of PrEP in Black America by sharing information about the coalition, our work, and new initiatives with communities and partners. Members support volunteer recruitment by developing outreach and recruitment materials, promoting opportunities through networks and events, and helping bring new people into PIBA's work. The committee plays a key role in relationship building, community engagement, and growing a strong connected base of supporters and volunteers.
Right. Thank you, Michael. Next up, we have the communications committee. This committee is led by myself and Rico Boone, who I don't believe is with us. Some of you got here because of this committee. Our promotion on our social media and LinkedIn, um, word of mouth, messaging, however you got here, we are grateful that you were here. In addition to those social media tools, this committee is also the one that creates our press releases. And so there are times that things that are happening within the HIV movement that may not be directly related to PrEP, but it is directly impacting our ability to provide HIV prevention services like PrEP within Black communities. And we need to have our say in that, regarding its impact. This committee is also focused on things such as National Black HIV/AIDS Awareness Day. So you are hearing this hot off the press about our town hall meeting that's focused on not only what we have lost nationally, as John has mentioned, the budget cuts. We're more interested in how those cuts are impacting Black communities across research, across care and treatment and prevention. And so we've been very fortunate to have Dr. Oni Blackstock agree to lead that discussion and that work, talking about the state of HIV within Black communities as it relates to finances. That's framing the narrative. But the good part is, what are we going to do about it? Because we are not powerless. Collectively, we are powerful. And what are those strategies to activate our power? And so if you're interested in those types of things, we will encourage you to join our communications committee. And last, but definitely not least, it's probably the number one thing that we are all talking about these days, and that is our fundraising committee. And so any of the leads from the fundraising committee, please feel free to share.
I'll jump in. Hi, everybody. So the fundraising committee is where the money resides. And we need y'all here to help us with that. And so this committee makes sure that PIBA has the resources, the relationships, the visibility to sustain and really grow our impact. We're excited to have you guys all here. We're hoping that you're going to become a part of PIBA, and that we're going to have the resources to do more work. The fundraising committee plays a really important role in driving funding efforts and telling the story of why investment in Black-led HIV prevention matters. So this committee leads and sustains grant writing for PIBA's programs and initiatives. And so you see this volunteer group of us. Shout out to Mandisa, shout out to Danielle, and so many other folks, people from PIBA who aren't even on the fundraising committee who jump in and help with grant writing. So we're excited and hope that we have some folks who are interested in grant writing, that've done grant writing, who want to help us with that work. This committee also helps to identify and share funding opportunities. We also want to make sure that we're leveraging our network to connect potential funders, sponsors, and partners. We support some of the campaigns and events through planning, promotion, and outreach. We contribute creative ideas to strengthen PIBA and really serving as an ambassador for PIBA with our community and professional circles. So we're looking for folks who want to do grants. We're looking for folks who want to do partnerships. We're looking for folks who want to like come in and support campaigns and coordinate with like the communications committee because communications, fundraising go hand in hand. So if you're interested in some reparations, making sure that there's investment in a Black-led movement for HIV prevention, I hope you'll be able to join this committee.
All right, thanks, Rania. Yes, I did hear reparations. So
You know, it's my favorite word. One of my top favorite words is reparations. Where is that money supposed to be coming back to us?
okay, let me see here. And so, Michael, um, if you share with the group, I think we've already added this in the chat, but how people can participate, starting with the interest form.
Yes, I saw Alicia dropped it in the chat earlier. Could we drop it again in case anybody joined after you dropped the link?
Sure.
So now that you've heard everything about all of the different committees and what they entail and what the commitment entails, we want to formally invite everyone on the call to join if any of those committees resonate with you, if you have the skills for that committee, or you want to work with others to further develop those skills. We definitely want to make sure that we're inviting Black HIV advocates to be a part of these committees and be a part of the growing PIBA family. And so the PIBA Coalition meetings will be the fourth Wednesday of the month. And you can sign that interest form that was dropped in the chat, and we will follow up with you about joining those meetings. And also, each committee may also have individual separate meetings to talk about individual issues as well. So definitely feel free to um, fill out the interest form. If you know someone else who may be interested but couldn't make today's call, feel free to share that with them as well. And this will also go out through our listserv.
Thank you, Michael. And we have ways for you to stay in touch with PIBA. This is our website. I'll also put that in the chat again. Our email after today's meeting, if you get an idea or you want to engage or share anything, please feel free to utilize our PIBA email to reach out and connect with us. So I'm gonna stop here. We have time for just kind of Q&A, and I'm gonna ask the steering committee just to be present to respond to any questions that our family members may have about PIBA. Know that now the floor is yours for any questions that you may have.
We do have one question that has come up in um, the chat, and that was around our frequency of meeting.
I think that that's a great question. This first meeting will help determine what that frequency is. I know, like many of us, we in everybody's coalition, trying to make sure, Larry, you smiling, so you with me. We trying to make sure that Black voices are heard. And so we are sensitive to that. This may be as a collective, a decision that we don't need to meet every month. Maybe with what we're doing, maybe a quarterly meeting is effective. And so we want to be able to like make that decision as a group, so that we are effective. We and we're meeting as often as we need to meet, but weekly may not be the answer to that. So I do hope that that answers your question.
Um, this is not a question from our community here, but it is a question that is about our community. Um, I think it's important for us to also talk about the ways in which we try to model the work that we are doing externally, internally. How is it that we work together and how we relate to each other in actually doing the work while also really being part of a sustainable and supportive community?
Anyone can answer that, by the
Yeah,
way.
yeah. I'm posing, and I will give a quick answer just to start. But one of the things that I really appreciate about working in this coalition is that we bring all aspects of ourselves into this work. We do not have to um, sanitize ourselves. We do not have to do a lot of the switching and compartmentalizing that we may have to do in other spaces. We bring our full selves into this, and I think that's an important thing to know. We get the work done, and we also understand that we are fully human and fully Black, and we need to hold space for all of that at the same time.
I agree with that, and I really appreciate that framing, Stacey. And part of what I have loved about PIBA from the first day I joined, and I'm someone who joined a little late. I'm not a co-founder. I actually started coming like out of the planning that came um, from the second event we had in New Orleans. Since I'm based in New Orleans, which I think is part of what I like about People's model, is it took someone like me who was involved in the local part and like, it was an entry point. But I like that sometimes in Black spaces, it's this assumption that there's one or two ways of being Black, and then there's only one or two ways that like of policy priorities, right? Or like this very narrow idea that can sometimes be very heterosexual or very cis, like or very based in a certain region or assume like a certain like middle class background. And the thing about PIBA is there's an acknowledgement that even in the Black experience, there is a multiple of ways that we show up. And that is a part of how we have our steering committee meetings and the things that are, important to us and the politics that we have. So I think, it's important. Something else is, it isn't us a like we don't hide the fact that many of us are also attached to other organizations. And so also being super intentional about how, even though maybe it's other hats that we have, like that we are here for PIBA as well. And just being honest about that's a balance, sometimes. And it means that sometimes like people are going to like step in a certain way or like, oh, I have this, I have to step back, but there's space for that. And I saw a question about sex and sexuality. Am I reading it wrong?
Yeah, we have a few questions that have
Okay.
been posed in the chat. One around the PrEP trial being conducted by Merck, and then a couple of questions around involvement in helping Black gay men um, in particular, but also the community in general making decisions around PrEP decision making?
So I could just give my 2 cents. So Wakefield, the first question about the PrEP trial. Um, to my knowledge, we are not involved in that trial, but maybe you should be joining the research committee to further elucidate how PIBA can be involved in that Merck trial. So that's one. Two, is PREVA involved in helping Black gay men make decisions about PrEP choices? As I mentioned, we've done webinars. PIBA has been more on the like national level, and those conversations have definitely happened in our convenings, in our town halls. Those issues have come up. So we like on an individual level, I would say the answer to that is probably not. But on a community level, where we are providing the information, we're educating about what all the choices one can make. That those conversations have happened. And maybe that's a question for the outreach committee. Maybe they need to outreach to more providers that work with Black gay men to make those PrEP choices. Maybe that's something that we can talk about in a specific committee related conversation. But as for how PIBA has functioned in the last 4 years, it has been a more national kind of conversation. And obviously these things of like getting Black gay men or Black trans folks involved in with their PrEP choices have come up. And also the question from Rodney about address sex, sexuality, PrEP decision making. All of these things have come up in our convenings and our conversations with providers, with the CDC, with all these entities. But individual level, maybe that's the work of that is the mandate of the committees to really do that deep work, because as a whole, PIBA hasn't really been able to do that on that specific level, that very focused level. But this is an opportunity for committees to jump in and do that specific work.
Thank you, John. I just like to add to that, like one of the reasons why the timing of us expanding and inviting more people to be a part of PIBA is so critical in this moment. Um, you may see things that are happening even in terms of clinical trials where people may not be present, but we may need to have a statement or issue a response about something that is impacting Black people who may be a part of those trials, or Black people who are not included in those trials. That also becomes the work of this coalition. I think as Mandisa was stressing, when we say Black, we mean all of us. And whatever form of that is you, that's who we represent. And so we definitely want to, be mindful of everything that's happening on the landscape in terms of HIV prevention, particularly, and its impact on Black communities, for us to be present or for us to have our say if it is necessary.
And Leisha, thank you for raising that point. I'll reiterate that when we get ready to close. Some nuggets from that, but that's an excellent point for us to raise. That this is the chance for us to continue to grow and expand. We're not here as an infomercial. We're here for an invitation. Right. There's another question that has popped up in the chat around what kinds of interactions and successes have y'all had in faith spaces? And I appreciate that question, and I'm glad that you have raised it. Although we, as PIBA, have not specifically engaged with faith spaces, all of us are involved in HIV prevention, treatment, and advocacy in multiple ways. I work in a school of divinity, and my work is literally at the intersection of faith and HIV, working with faith communities, particularly in the South, around addressing not just the public health imperative around HIV and PrEP, but also the theological implications of it. So, again, if that's something that you are interested in, please reach out to the research and evaluation team because we would love to have your voice and your experience represented in the collective work of PIBA as well as any individual work that we are doing where we might be able to collaborate. And I think that's another important thing to lift up here. This is an amazing network of people to be a part of. The insight, the expertise, the resources that exist as part of PIBA are phenomenal. And we want to serve as a nexus space where we can bring all of these disparate threads together and tie them together in order for us to have the comprehensive and collective impact that we know is going to save lives and change communities.
Hi, Deneen Rodney. I just wanted to say hello and thank you for somehow getting on this invitation to be part of this. My work with in this space spans well over 15, 16 years. And I'm here as a Black woman. I'm here as a founder of my company, but also committed to better outcomes. So however I can support, I'm more than willing to do so. And I love to see so many people that look like me.
Denny, thank you so much for sharing. All of that is joy for me today. So thank you. I see Michelle Hardy.
Yes. So before we ended, I just wanted to introduce myself. I was in commute, so I wasn't able to like take my camera off, but I'm Michelle Hardy. I work currently in the pharmaceutical industry. I'm an account manager for a new injectable form of PrEP, which is called Yestugo, comprised of lenacapavir. So it's protection over 6 months with an injection. And I work primarily in New York City in the Harlem area. I'm from Harlem, and I'm dedicated to seeing the epidemic end. And I believe we have all different options, including oral, and now we have long-acting injectables. We also I was just listening to everyone, the committee leaders, and I'm not certain like what role I could play being part of the pharmaceutical industry. But if there is an interest in more education about long-acting injectables or different forms of PrEP amongst this body, that's something that I could probably support and bringing like a medical science liaison that works with me or someone on a call to like just do a little presentation just for background information. Would
Michelle,
like to, yes.
I wanted to say hi. I feel like we've interacted before, but I'm Harlem based, so I just linked.
Okay.
I think are you part of Abyssinia?
Yes.
Oh, so we've linked up, but I just linked up. I just reached out to you on LinkedIn, so let's reconnect because
Okay,
and I
fantastic.
just finished a project with Gilead, the Gilead campus in California. So let's definitely
Yes. So nice to, I guess,
nice to
meet
see
you
again.
again in this
Yep.
format. I guess that's the beauty of this type of network. Like you get
Yeah.
to meet and connect with new people. And I'm gonna end by saying that what my main not challenge, but my main goal in this role is to increase awareness amongst all people of color, including women, all different lifestyles, whatever you represent. But I want everyone to know their options in terms of prevention, because if we're going to get to see the day where we end the epidemic, we got to go at this point, like really grassroots. And so that's why I wanted to join the call today to hear, ideas and, and share whatever resources I have. So nice to meet all of you. And thank you for inviting me.
And I feel like in this environment where trustworthiness and trust has been dismantled, I see a lot of people thinking that racial concordance doesn't matter, how we engage in people doesn't matter, but it's just the opposite, right?
Yes.
And so we have to kind of make sure that people understand that and we lean into it.
Yes. And one last comment, another thing that I do and I'm dedicated to doing is getting the providers who are seeing the patients of color to feel comfortable with sexual health conversations,
Yes.
any
Yep.
type of provider. So
Yep.
you don't have to necessarily be in a STD clinic. You can be meeting with your urologist or OB/GYN, but or primary care for that matter. But those conversations should be had and they should be normalized so that patients feel comfortable having them. So
Yep.
that's
Yep.
what I'm dedicated to doing.
Yes. Well,
So
let's
we're
talk.
glad we were able to one make the connections. Two, y'all just started the title for 3 or 4 abstracts for meetings. This is wonderful, wonderful.
Yes,
Yes.
Any
definitely.
final comments or thoughts before we turn it back over to Stacy for our closing on today?
Yeah, I have one more thing. First of all, like that exchange was just chef's kiss. It was just so juicy. It was
Oh,
just so
nice.
beautiful and like part of what PIBA is here, to do. As John said, we're a convener. And convening isn't just like in person.
Mm-hmm.
But I'm thinking back to like an earlier question in the chat about um like more individual interventions, and I think of the importance, and I think of the work that we've done as far as addressing like systemic barriers. Like I think back to um our panel at SOS, which is an intentional Black LGBT space. I think back, of course, to the amicus brief. Like I think back to like our other policy and advocacy work. And even though that work wasn't about like uh people like in an interpersonal like or individual sense having access to medication, it was about that, right? Like our interest in Braidwood was about this is another barrier to people not being able to have that question, like to have that as an option. Like I think back to like how do we hold space for the ways in which, as John said, like our work historically hasn't been doing some of the things in the chat. And I also want to hold, we actually are doing those things in the chat from a systemic, framework, right? Like acknowledging that systems barriers are very much in place. And so I'm really curious about the ways to continue to have that conversation, especially in this moment, like where so much is pivoting. All that to say, I'm excited to have new energy, new blood, in this conversation to help us make some pivots and to continue doing the other work that we've been doing.
Thank you for that, Mandisa. Stacy, we are turning it over to you for our closing.
All right. Well, I just want to echo what has been said that this conversation has truly been invigorating. Um, we have been doing this work for a minute now and are committed to it. And hearing where you all are coming from and what you all do and what y'all can bring to this and how we can create new things together is so exciting. So thank you for lending your time to us on this day. And so I just want us to close not only with gratitude to you, um, I do also want to address a question about how do I find out where I best fit. If you just complete the interest form, we will gladly reach out to you and we can have more dialogue with you about where you feel as though you might have the, you know, the the best fit and the greatest impact. So please just don't be afraid to indicate where your interests are, even if there are multiple. And I want to just close with us thinking about this. Um, and I mentioned this before our meeting began with the convening committee, but let's remember the words of our forebears that in times of struggle, we are called to lift one another up. That is the work that we're committed to in PIBA, to be able to lift our communities up and make sure that we have access to everything that we need in order to be healthy and whole. And so our work is guided by justice, it's driven in love, and it is informed by an unwavering pursuit of equity, where we are working for a world where health is a right and not a privilege for every Black person, regardless of circumstance. So we walk together in solidarity, and we look forward to the work of transformation that can come out of this. So again, thank you all so much for your time and your energy. And yes, big shout out to Rochelle Merrick, our coordinator who has been working behind the scenes. Um, we are so appreciative for your work. And so, again, please make sure to complete the interest form, and we will be following up with you shortly in order to help make sure that we keep this momentum going.